Hello, this is Dr. Wells with Wells Medicine. In this fourth video, we talk a little bit more about things to add during your ketamine infusion series and how to build on the progress that you're making so far and what to look for in terms of things to continue adding, continue building on, and how long the treatments are going to be effective at this point, and continue thinking about maintenance and building on the benefits that you've seen. So by the fourth ketamine infusion, we have a pretty good idea whether you're in the 70 to 80% of patients for whom this works for, or whether you're in the 20 to 30% of patients for whom this just might not be the right treatment. And to know that, we're going to be asking you how you're feeling, how you're responding, if things seem to be getting a little bit easier. Sometimes by this point, patients really know, and they say, wow, I'm feeling so different. Sometimes at this point, families really know, and they're like, oh, you really need to keep going back. I see such a difference in you. And sometimes at this point, we can tell based on the score from the quick inventory of depressive symptoms. You may not be feeling a tremendous difference, but if your score is decreasing and your family's noticing, then we're probably going to say you're in the 70 to 80% that are responders. We just need to continue a little bit longer. There are some things that can slow down the feeling that you're getting a benefit from ketamine treatment. Some of those things are heavy use of benzodiazepines, heavy use of alcohol, heavy use of marijuana, and while you're going through big life changes. So if you are going through a divorce, you are in a hospice situation for you or your family, you're going through job changes or a move or big life changes, that can also make things very difficult to see that your mood is improving. Sometimes during those sorts of changes, what we see isn't that the mood gets better, but rather that patients have a lot more resilience and flexibility to deal with those changes. That might be all we're going to see during those big changes. There are probably 10 to 15% of the non-responders who will eventually respond in the fourth, fifth, and sixth infusions. I don't generally push patients to come in after the third if they're not seeing a big difference. Part of the reason is I want them to be seeking out something that will make a big difference for them, and not continuing to do ketamine therapy if that's not going to be what finally works for them. And part of the reason is I worry that if there isn't a response by the third infusion, even if we can get a response in the fourth, fifth, and sixth infusion, is that going to be a long-lasting or durable response? And I think the jury is still out on that. Now, if a patient is using benzodiazepines, marijuana, alcohol, then we do tend to see a response kind of later in the treatment window, in the fourth, fifth, or sixth treatment. Something as well to think about is if you stop after your third because you don't feel like there's been a significant change for you, it's okay to take a treatment break and then to wait a few weeks and see if your mood starts fading back to the way it was before you came in for the infusions in the third and fourth and fifth week. We do have a significant population who take that treatment break and then say, hey, you know, my mood was better. I really only started noticing it once the fade from the ketamine infusion started. I really only noticed it once I started getting anxious again. I really only noticed it once I started having those depression thoughts come back again. And so you won't lose anything by taking a treatment break. But sometimes it does help clarify that these changes that you're seeing are real and they're related to the ketamine, and that that you are having some benefit from the treatment. By the time patients come to see us, it's treatment-resistant depression or anxiety. And so that means they've been through quite a few treatments. And part of that means as well that there's almost the opposite of a placebo effect. So they almost don't believe they're going to get better from ketamine since they didn't get better from the Paxil or the Prozac or the sertraline or the Effexor. And so there's some of that we have to fight against as well. During the fourth and fifth infusion, we'll talk about this as well a little bit during the fifth infusion, there is kind of a reawakening or a reinvestment in life that patients experience. And sometimes that can be very disheartening as well. So there's kind of the benefits of ketamine treatment warring against this idea of now I'm involved in my life again, I'm interested in my life again, and I'm not where I want to be, and a disappointment or kind of grief that patients can experience. Sometimes this takes the form as well of berating yourself or kind of self-flagellation to say that you're not as good as you should be, or you're not as good as you could be, or you're not doing as much as you wanted to be. And we'll talk about that during the infusion as well. But if this was a broken leg, I invite you to kind of think about it as a visible physical injury. If this was a broken leg and you just got your boot off, you wouldn't be berating yourself for walking too slowly. And so I think it's really unfair to be able to say those things to yourself, or to feel like your family are saying those things to you because it's an invisible mental illness. But I think we feel a lot freer to say those things to ourselves because it is mental illness and not a boot on your leg or a pneumonia. So one of the things that we like to talk about during your fourth infusion is, again, we're going to be going through the vitamin supplements, the exercise, the outdoor time, the meditation and prayer that we've talked about during the first 3 infusions. And then we're also going to touch on a little bit, now that you've measured your caffeine intake after the 3rd infusion, now's a great time to start decreasing any caffeine intake and to start looking at other factors in your life like marijuana use, alcohol use, and any benzodiazepines, and to start looking at how much you use of those, when you use those, and whether or not those are things that are things that you can choose to limit or choose to decrease slightly as we go through this treatment. If you're in the 20 to 30% for whom ketamine really doesn't seem to be the best answer for treating your depression or anxiety, still those are good strategies to be picking up and adopting anyway. After the 4th infusion as well, this is a great time to look into either life coaching or evaluate your therapy, see whether that's working for you. And then particularly, we recommend cognitive behavioral therapy. Life coaching is just another method of cognitive behavioral therapy. You can find cognitive behavioral therapy workbooks online. You can find them in downloadable form. You can order them from Amazon. And we can sign you up as well for the This Way Up program, which is through the Australian National Mental Health Service, a completely free program that allows you to sign up for a cognitive behavioral therapy program that's interactive and educational. I hope these videos are useful in preparation for coming in for ketamine treatments. And if they are, please let us know by liking, subscribing, leaving us some comments. Let us know what would be more useful for you to have information about. And I hope to see you in other videos.